I'm here at South Shore Health waiting to meet with Dr. Todd Ellerin, Chief of Infectious Disease. Obviously, we're here to talk about coronavirus or COVID-19. We've heard an awful lot about it. It's raised a lot of anxiety, if not outright fears. Our hope is that Dr. Ellerin will provide us with some good factual information and reassure us that at least here on the South Shore, we're ready to deal with this virus. Dr. Ellerin, it's great to have you here this morning. Can you tell us what's your role here at South Shore Health?
I'm head of infectious diseases.
And how long have you been here with the system?
About 17 years.
So we're here to talk about the coronavirus, also known as COVID-19. What can you share with us that we haven't already heard on the national news so far?
All right, well, the first thing we have to do is take a deep breath, okay? Because we're going to be okay. Obviously, it can be scary when you hear about a novel virus that's contagious like this. But the good news is that overall, and the CDC has said this, that while it's contagious, the mortality is relatively low, okay? So I think of this like another flu-like illness. With that said, this is obviously evolving, it's dynamic, and we're learning more about this. But what we've seen so far is a virus that started in Wuhan, China, but now has spread beyond that, where now more cases are actually occurring outside of China rather than inside of China. And as you know, recently, we're hearing about more cases in the United States, which is expected since this is a contagious respiratory virus.
Now, this virus in particular is having a greater impact on individuals over a certain age. Is that correct?
Yes, it's acting more like influenza A, which tends to affect older patients and patients with more compromised immune systems. It's true. In fact, it's very unusual to see any severe illness in patients under 30.
I've heard talk about these individuals over a certain age should have their pneumonia vaccinations and their flu vaccinations. Is that advisable in light of what's going on right now?
Super important, because remember, this COVID-19, I said it's like a flu-like illness. These symptoms are similar: fevers, cough, chest pain, oftentimes associated with pneumonia. We see that both with influenza, which can cause similar symptoms, and with bacterial pneumonia as well. And we have vaccines, obviously, against influenza, and we all need to be vaccinated against that, and as well as pneumonia, okay? Now, not everyone is eligible for that. So if you're eligible for what we call the pneumococcal vaccine, then that's something that you definitely want to have, because one of the complications of COVID-19 is bacterial pneumonia. So it's possible that that can protect against one of the complications of this virus.
Let's talk about the symptoms associated with COVID-19. And when I talk about symptoms, what can the average person look for and expect if they suspect either themselves or someone close to them has perhaps contracted this virus?
Okay, so this does look like the flu in most cases. So the most common symptoms are fevers and dry cough, okay? You can also have chest pain. You can also have other signs and symptoms of pneumonia. But because it's so common, you can also have aches, you can have sore throat, you can have a runny nose. Those are less common, but absolutely present. As we're seeing more and more cases, we're seeing more of a variety of symptoms, and that's to be expected. Now remember, also, you can be infected and be completely asymptomatic, no symptoms. That's at one end of the spectrum. At the other end of the spectrum, you can be fighting for your life in the intensive care unit with severe pneumonia and what we call the acute respiratory distress syndrome, okay? Fortunately, most patients have milder disease, and it's only the minority of patients that have the more severe disease.
How long does this virus stay on a surface, for example? And we see people running around with masks. Is that advisable or not? And what kind of precautions can we take in terms of just touching common surfaces, like doorknobs and the like?
Okay, so you've asked three different important questions. The first one is surfaces. I mean, remember, this is a new virus, so we don't know how long exactly this can be on surfaces. It's likely that if you sneeze into your hand, which we don't want to do, right? You want to do the inner arm. That's important because then you touch a doorknob. If someone else touches it immediately after, it's possible that they could be contaminated, and then if they touch their eye, then transmission could occur. Now, this virus is not a very stable virus, so it's unlikely that it's going to survive on that doorknob for long periods of time, but we don't have the exact answer for how long. The other problem is we can do amplification studies where we try to amplify, this is an RNA virus, we try to amplify that, but just because we're able to detect it on that doorknob, for instance, doesn't mean it's actually alive and has the ability to infect someone else. So how long on surfaces? It's a question that we don't have the exact answer to.
Let's talk about the masks.
Okay.
There's a run on masks.
There's a run on masks. So what's very important is that we should not be buying masks and then putting masks on and going out into the general public, okay? Masks are best used if you have fevers and respiratory symptoms and you have to go out into the general public. Then you do want to wear a mask to try to contain the secretions and prevent that from escaping and infecting other people. Now, if you're taking care of a loved one in your home, okay, ideally you want to stay more than 3 to 6 feet away from that person. In those cases, the person who's sick should don a mask, which means put on a mask, and if you have to get very close to that person, okay, for an extended period of time, which is not recommended, then it may be prudent to also put on a mask, okay? But this is very limited scenarios. Now, obviously in the healthcare setting, when we're taking care of the sicker patients, it's a very different circumstance. As healthcare providers, the CDC is recommending that we wear respirators, okay, to take care of patients with confirmed COVID-19. But I think that's also out of an abundance of caution that we're doing so. We also put these patients in negative pressure rooms, okay? But again, I think for the average person, it's unlikely to spread this as long as you stay more than 3 to 6 feet away from that person.
Doc, let's talk about self-quarantine and what does that really mean? And particularly in a multi-generational home where you've got a grandparent with school-aged children in the house as well.
Yeah, so Joe, let's talk about a couple of definitions first. Let's distinguish quarantine from isolation. We isolate patients who are symptomatic, have fevers, have respiratory illness, maybe have been even confirmed to have influenza or COVID-19. Those patients get isolated, separated from others, but we know that they have active infection, okay? They could even be asymptomatic, but if they have confirmed to be COVID-19 positive, those are patients that we would isolate. Quarantine is when you are asymptomatic and don't have the infection, but you may have been exposed to someone with that infection. Quarantine is a form of isolation, but it's when you're trying to protect someone and trying to monitor them to make sure they don't develop active symptoms. In both cases, you have to make sure that you are separated from other people. If it's within the home, if it's a home quarantine, you have to make sure that you are in an isolated room, that you have a separate bathroom, that anyone who comes into close contact within 3 to 6 feet, that both people are wearing masks to try to prevent the spread. We saw, unfortunately, with the cruise ship, the Diamond Princess, we saw quarantine go bad. So what happened was you're on a vessel where you had at baseline, when they recommended the quarantine, there were actually a number of patients who had already been infected. And there was also crew that was infected. And some of the issues were that the crew, they were dining together. So it became a bit of a mixing vessel. And over time, we just saw an increase in cases. That is an example of what we don't want to do with quarantine, okay? So the other thing to remember is that as a provider, okay, as a physician, I do not advise or recommend anyone to be quarantined. That is something that is done at the state Department of Public Health level. That leadership, they tell us whether they are recommending the institution of quarantine.
So what are some of the tips that one can use to protect oneself from this coronavirus?
Yes, exactly. So very important and very basic. A lot of these are basic infection control tips. And remember, we have a lot of experience. We're going to use a lot of these tips that we use for influenza. And remember, we're in the middle of an epidemic right now of influenza. Okay? Hopefully we don't have a tale of two epidemics coming together, but I think we do have to prepare for that because that is possible. But some of the basic tips are, if you have a fever and respiratory symptoms, don't send your child to school. Don't go to class if you're in college or at university. You know, stay out of work. Especially in the healthcare industry, we tend to use a term called presenteeism, which means it's the opposite of absenteeism, meaning we'll do anything to work because we want to take care of our patients. We have sick patients, we care about them, we want to make them better. But at times like this, the risks of us coming to work if we have a fever and respiratory symptoms outweigh the benefits because we could spread this virus around our system, and that's a problem. So that's very key. Again, we talked about avoiding shaking hands. Better to do a fist bump or an air five. Cleaning your hands. I can't say enough about it. Whether it's alcohol gel or whether it's soap and water. Doesn't have to be antibacterial soap and water, doesn't have to be a liquid soap, it can be a bar of soap, but hand hygiene, really important. You really want to cover all surfaces and mechanically cleanse those hands to get the virus off. The good news about alcohol gel is this coronavirus is an enveloped virus. It has an envelope, and the alcohol works by disrupting the envelope. Very different than something like norovirus, which you know, this is responsible for a lot of our nausea, vomiting, diarrheal illness, right? That lacks an envelope, so alcohol doesn't work to protect us. Instead, soap and water is better, but for COVID-19, alcohol gel is excellent. So these type of basic infection control principles can really help decrease the likelihood of transmission. When you cough or sneeze, cough and sneeze into your arm.
Makes sense.
Yeah.
Let's talk about the resources that we have here in our community, here on the South Shore. Do we have access to test kits? And do those test kits have to be sent to the CDC out of state, or do we have the ability to examine those test results here in the Commonwealth? Okay,
so that's a great example of a very evolving picture. Okay, so if you looked a couple of weeks ago, or maybe even last week, okay, the CDC was doing the majority of the testing for COVID-19 across the country. The goal initially was to have the state laboratories be able to do this testing. Okay, there were some snafus going on with testing. Okay, so there were some problems with some of the reagents, meaning some of the parts of the testing kit. So things were delayed a bit. Okay, the good news, okay, is that currently, and in Massachusetts, now the Department of Public Health, our state lab, can do COVID-19 testing. Now, as of right now, I've heard that positive tests at the state level still get sent to the CDC for confirmation. I don't know how long that will go for. But the answer to your question is that yes, the Massachusetts State Lab can do testing locally, and that's a step in the right direction. The other thing that's changed that's very important is, as of 2 days ago, the CDC criteria for testing was fairly narrow. They recommended testing if you had a flu-like illness and a direct contact with someone with confirmed COVID-19, whether you're an outpatient or an inpatient. Additionally, there were 2 groups of hospitalized patients that could be tested for. If you have a flu-like illness and lower respiratory tract infections and you travel to one of 5 countries, okay, then the lab would test for that. The other group would be if you had severe pneumonia, meaning like if you're in the intensive care unit and you have severe pneumonia and you've excluded influenza and some of the other circulating non-COVID-19 respiratory viruses. So that was a limited group. As of yesterday, the CDC just changed its criteria to say it can be clinician advised, meaning if you have a high pretest probability that your patient has COVID-19, then you can test for that. Now, the question is, are the state labs ready for this type of volume? And that's something that we have to reach out to them, we have to communicate with them, and it's really their decision. So it still rests with the state to figure out which patients will be tested.
Within our South Shore health system, within our community here on the South Shore, do we have the readiness, so to speak, with respect to our institutions, our healthcare institutions, here at South Shore Hospital, for example, in Weymouth, or down at Jordan Hospital in Plymouth and Quincy? What's our state of readiness and preparedness there?
Okay, so I can speak for South Shore Health, okay? And I have a lot of confidence in this place. And the reason is because we have a large multidisciplinary team, and many of the leaders that are helping us get prepared here have been involved in the SARS preparation back in 2002, 2003, okay? The H1N1, the pandemic flu, back in 2009, 2010. We were part of a team that prepared for Ebola, okay? And now, currently, COVID-19. So we have a lot of experience. We take this seriously. We meet regularly. We send a lot of communications, and we drill for this. And we've had to rule out patients with COVID-19, so we already have experience trying to, and we've also had persons of investigation here, okay, even though we haven't had confirmed cases. So, we've dealt with the state. We have people looking into our personal protective equipment, making sure we have enough. We have engineers looking at our isolation rooms, making sure that the negative pressure is working, things like that. I feel very confident that we're ready to take care of patients with COVID-19.
Within our community, we have a number of condominiums, apartments, as well as senior centers, assisted living. Are there particular protocols and practices that you would recommend to these particular facilities?
I think all of these facilities need to be abreast of what our current recommendations are, okay? And remember, basic infection control principles are at play here, okay? If you have a fever and a respiratory illness, you want to stay away from other people, okay? If it's mild illness, you really want to stay where you are. You don't want to start going to other, healthcare settings, urgent care, emergency rooms. Really important that this is, remember, for most patients, this is a mild respiratory illness. But now when you start getting into senior citizens, we do expect to see more severe cases. In those cases, for patients who are, short of breath or, very confused or really have severe signs and symptoms of infection, we do want to see those patients in our emergency department. With that said, ideally you're going to give a heads-up call first so we can prepare the family member or whoever's going to take that patient to us. Will make it a safer travel, not just for the patient and the person taking care of that patient, but also for our system.
Is it advisable that we begin to reduce our exposure in large venues, whether they're concerts, sporting events, and the like?
Yeah, it's really difficult. Of course that makes sense, but I want to balance the kind of the social disruption that works versus also with the knowledge that we don't really know how much these measures will help overall. So I think that these are personal decisions, and a lot of it has to do with your risk tolerance. Should you go visit your grandparents with your kids? But what I do think is more importantly than saying no, we shouldn't do that, it's that maybe changing our behavior a little bit, meaning try not to shake people's hands. We didn't shake hands. Normally I would have shook your hand, but instead we did the elbow bump, right? And I think that makes sense at a time like this. Maybe it's best not to have the grandchildren kiss the grandparents right now when they may be harboring COVID-19 and they could be asymptomatic. And we do think that it may be possible to spread this even when you're asymptomatic. We don't know how much that contributes. Obviously, if you're sick and have fevers and respiratory symptoms, you don't want to be visiting the grandparents. So, I haven't answered your question directly. I think these are tough calls. I guess it does make sense at a time like this to try to stay away from large gatherings if you can. But these are tough decisions because obviously they're very disruptive.
Can you think of anything else that you want to share with our audience about how we should be prepared to deal with this coronavirus?
I think that ready.gov, which is online and it's put together by Health and Human Services, has some excellent recommendations on how to prepare for a pandemic. Now, no one's used that term formally yet, but you could imagine that in days or weeks that term may be used, since we are watching this virus circle the globe. A few things they recommend. One is prepare for this like you were preparing for a bad blizzard. Okay, you would do certain things. They recommend having enough food and water on hand for about a 2-week period. Okay, they recommend making sure that you have enough medications, prescription medications, and try to have extra on hand in case you run out. The fact of the matter is we are seeing some social destabilization. We're seeing people cancel trips. We're seeing flights that are unable to go to certain parts of the world back and forth. So, I think that what ready.gov is making us think of is that it's just better to be prepared. Not that we want to panic, because we don't, and there's no reason to. Like I said before, this is another flu-like illness. Okay, now granted, we don't have a vaccine for it, and right now we don't have antivirals to treat it that have been proven to work. But we are going to get through this. But I think with common sense measures, making sure you have, cold and cough remedies on hand, okay? You may want to have, if you have your health records electronically, you may want to print them out and have copies of it in case we have to do more communication over the phone. So I think these type of common sense practices does make sense at this time.
Dr. Ellerin, this has really been informative, and I hope that our community at large has an opportunity to take the information that you've shared. It helps to inform and hopefully reassures them that we're prepared. Thank you again.
Thank you, Jeff.
Have a great day.